this. He will go to that podium. His wife, as we know, Sophie Grégoire Trudeau, has tested positive for COVID-19, so she's in quarantine. The family's being isolated in the household there while we expect to hear him say that all international travel will be funneled through 4 airports in this country: Toronto, Montreal, Calgary, and Vancouver, so that there can be better screening measures focused on these 4 airports, more personnel, more close contact from those personnel in terms of really paying attention to which passengers are getting off those planes and how they're doing, what they look like. There's also, as we've mentioned in our coverage so far today, some increased measures for screening at the airports when people arrive. Those kiosks where you arrive and return to Canada, there are now a couple of questions being added, and that is that you are being asked right up front on that questionnaire on the screen whether or not you are exhibiting any symptoms. You have to answer yes or no. And they also are making travelers respond to an acknowledgement that they have been, here you go, you can see it here, that they have been told about these measures of quarantining. I acknowledge that we are being asked to self-isolate for the next 14 days to prevent the potential spread of COVID-19 for those travelers returning to Canada, and they are required to press the acknowledge button. So some stepping up of the process there, but we can expect when the Prime Minister does come out to speak with reporters, there'll be lots of questions for Justin Trudeau about why these measures now, why not sooner, why, when there have been calls for these stepped-up screening measures at airports, for instance, is the government just getting around to them now when they've been pressed on this for some time. My colleague Martin Stringer is with me as well. He may also, Martin, be facing questions about tougher action at the border itself. We heard Doug Ford today say he's been telling government officials, asking government officials to get tougher at the border. Precisely what he's asking for is a closing down of the border to tourists, basically, anybody coming into this country. No more tourists coming into Canada, but he doesn't want trade affected, so anybody coming here for trade purposes or the movement of goods across the border would stay, but any people coming for leisure reasons would not. So I guess there'll be a certain pressure on the Prime Minister today, again, to be pushed to take greater action.
But on that question, obviously the devil's going to be in the details, because Doug Ford made that distinction between, say, tourists going across the border, but also how about all the other people? There are literally hundreds of thousands of people a day that go across the border for business purposes. I know when Alberta made its announcement.
I think he was pretty clear today saying he doesn't want trade affected.
Right.
He's talking specifically about visitors, that people aren't coming here or going for official business, I guess.
But there's even also the question about, for example, people who cross the border back and forth, and this was the issue that came up in the Alberta briefing, and that is, for example, truck drivers and all that. There's a concern about possible contagion, but obviously those people have to be able to continue to go. So the Alberta government minister yesterday made a point of saying that they are working on protocols to try and deal with the trucking associations, for example, actually testing or having questionnaires for their people who cross the border, sometimes, if not more than once a day, several times a week. So it's a big issue and an economic issue. The other questions I think we should watch for the Prime Minister being asked, one of them inevitably, as the head of the federal government, as we've seen as we've gone across the country and listened to different health ministers and governments across the country, he will be no doubt asked about federal standards. I mean, there are different ways of treating, and in terms of isolation and quarantine, but also in terms of what's being open and closed. And a lot of Canadians wonder why the differences. The different jurisdictions say, well, we're responding sometimes to different conditions and different situations, but the Prime Minister will probably inevitably be asked, shouldn't there be maybe one standard for school closures for public?
I also think there'll be some questions probably about the availability of federal equipment and testing, and the government's pledge to make that available to help bulk buy for the different provinces. So questions about where that is. I should also point out we're getting a release from the White House that the G7 leaders have had a call and they've agreed to essentially take any measures they need to deal with this outbreak from a health standpoint, but also from an economic impact standpoint. So I'll just give you some of the bullets from the release that's been issued following this conversation. It says, G7 leaders, we're committed to marshalling the full power of our governments to coordinate unnecessary public health measures to protect people at risk from COVID-19, restore confidence, growth, and protect jobs, support global trade and investment, encourage science, research, and technology cooperation. By acting together, we will work to resolve the health and economic risks caused by the COVID-19 pandemic and set the stage for a strong recovery of strong, sustainable economic growth and prosperity. So I think we might hear the Prime Minister be asked about that as well, too, is where G7 leaders are on a more concerted, united approach to dealing with the outbreak beyond these statements that we're going to do everything we need to do. What specifically, and we'll be looking for more detail on what the specific measures are that would allow more of a global response. One of the things we heard from the WHO today in that news conference was they are really emphasizing the need for testing. They can't. They're suggesting we can dealing with this disease and this virus so that we can know as a global community how to fight it. So that was the emphasis of the World Health Organization news conference today, was you really need to be getting on the testing part of it and make sure that we're testing everybody that needs to be tested.
The other thing to watch for is that we know that the ministers last Friday, when there was an announcement by the Bank of Canada Governor and Minister Morneau of packages to people have been suggesting it might be tomorrow, but who knows, we might see it today. But that is, we have been clear.
Has been saying it needs to be $20 billion.
And described as a major
we heard
package
from the Finance Minister last week that we think that's coming this week. So we'll continue to watch for that. So what we're going to show you here is that we saw the steps where the Prime Minister is. So we're going to hear from him shortly. Then what's going to happen is he's going to make a statement to Canadians and take some questions from reporters there, we're told. And then we are going to be moving to the National Press Theatre in downtown Ottawa, where that slate of federal cabinet ministers, the half dozen of them, will be there, including Canada's public safety officer, public health officer, Dr. Tam will be there as well, along with those cabinet ministers, and they will be taking questions beyond whatever the Prime Minister has taken from reporters there. So that's clearly sending a message to Canadians as well that the Prime Minister will be there. He's in to continue on in that vein as well. So we are standing by to hear from Justin Trudeau and some of these increased measures that he will be announcing the federal government is prepared to take. And we'll stand by for that and have that for you as soon as he comes down those steps and makes that announcement. And that presumably will in the next couple of minutes, as it looks like they continue to make sure that he has the technical requirements are set for the Prime Minister to do that. So maybe if they're doing that now, maybe that's it will be soon to come. This, Martin, will be these measures that would stream some of these flights to key airports and the tougher measures at the airport. How much do you think he'll be facing questions about the issue of timing and why it's taken to this point when some have been calling for that to
self-monitor and self-isolate? But obviously, there have been some shortages, shortcomings we saw over this weekend when people were not even being questioned on what had been announced by the federal government on Friday. There was actual anecdotal evidence that people were not being fully briefed and fully questioned as they arrived in Canada. However, much of this may, one might argue, become more and more of a moot point as actual travel to Canada starts to go down. We'll see with the centralizing of flights to the 4 major airports, well, what's happening at the same time that's happening is that major airlines are having obviously fewer and fewer flights into Canada. One of the other things that was mentioned this morning in the Ontario press conference, which was interesting, and that is we have a lot of snowbirds, Canadians who are spending time in southern climes, especially in Florida. Well, the Ontario chief medical officer did admit that several people coming back from Florida are testing positive. So there is another concern about Canadians who have every right to be coming back, but there is a very real possibility that they have contracted the coronavirus in Florida or in southern parts like Arizona or wherever they've gone, or even the Caribbean. So that is going to be a concern, and that once again is why the testing and the screening measures are of utmost importance. But the interesting thing too is that Theresa Tam, the Chief Medical Officer of Canada, is no doubt going to be asked about where she sees this outbreak, this epidemic, this pandemic, where she sees it, where is it at. The Chief Medical Officer of Ottawa made a lot of headlines on Sunday when she commented that she was talking about what she called community spread, and she was referring to how she thinks that there's now cases of community spread in Ottawa, and that is of course cases that they've not been to track to people who've recently traveled, and that's caused a lot of speculation, a lot of questions about where are we in terms of.
She's talked about, which she said this weekend was that there have been a couple of cases that have been people have tested positive, been in the community. So whether that actually turns out to be the case, but lots to watch, lots of different approaches being taken across the country. Schools being closed indefinitely in some provinces, closed down for fixed time periods in other provinces. closing, Ontario, Quebec, Saskatchewan, Alberta. So lots of measures being taken in Newfoundland and Labrador today. In the next couple of days, their schools will be closing as well as they move to mitigate the possibility of close contact, these distancing measures, and to try and mitigate this whole notion of community spread. If they can sort of find a way to stop these big gatherings, including schools, they're looking at doing that in provinces across the country.
One of the intriguing things, and it's a difficult time to be a politician right now, but one of the intriguing things is the way politicians have announced the measures that they are announcing. For example, in Alberta, they announced the closings indefinitely of the schools, whereas we know that Premier Doug Ford, when he announced the closing in Ontario after this March break, it's a closing of 2 weeks to be revisited. So it's obviously people are announcing these measures in a different way. Premier Legault, in a press conference last Friday, was clear about saying we are in this for a long haul. This is a 3 to 6 month phenomenon that we're facing, according to the epidemiologists. So he's spoken openly about a much larger phenomenon, a much longer time period. So it's interesting how different politicians have couched things, obviously with closures with regards to things like daycares as well. So a lot of provinces saying this will be a closure for 2 or 3 weeks and then we will revisit it. But you have Alberta saying, no, we're just going to tell you that we are closing these schools indefinitely, and then we will see when we are in a position to open them.
Yeah,
so
we have some, we're a political channel and we cover Parliament principally, and so we keep an eye on what's happening with federal politicians as well. So Mark Garrettson is a Liberal MP from Kingston in the Islands, and he's tweeting out now an update on his mom and dad. So it's just telling you this because it shows you how the outbreak is connected, how families are connected, and the consequences of where this thing moves. Update on mom and dad. Hey, everyone, word's gotten out, and I wanted to confirm that mom has tested positive for COVID-19. She remains in quarantine at CFB Trenton and has been moved to a new area and separated from dad. He will not be tested until he shows symptoms. Also tweeting that other than a cough, she has no other symptoms and is in great spirits, but that fortunately this has reset the clock on dad's 14-day period, and mom will remain until she repeatedly tests negative. Just to give you a sense of how this travels, and when we have a personal experience from someone we know as a federal MP, we can relate that to you, and that may connect with a lot of Canadians who may be going through the same kinds of experiences themselves, as if they have loved ones or family members or close friends that they know are going through this same process.
When we heard last week, obviously, that Sophie Grégoire Trudeau had tested, Sophie Grégoire Trudeau had tested positive for the coronavirus, it brought the whole thing home, that this is a profoundly democratic thing, a virus. Health concerns, everyone's open to this. The Spanish Prime Minister's wife tested positive, and that's a country that's on complete lockdown. And they're talking about a very high percentage of Canadians who will contract this virus, because let's be clear, this is in many cases not an extremely harmful virus, but it is serious in a small number of cases. So many Canadians, all the epidemiologists are forecasting, will be contracting this virus over the next 3 to 6 months. So it's something we're going to hear more and more about, and more people that we know will be contracting the virus.
So continue to follow 2 venues for you here. This is the front porch of the Prime Minister's residence, where Justin Trudeau, running right now about 35 minutes behind schedule, is expected to come out and speak with, make a statement to the nation, then take questions from reporters. Then we'll be flipping over, when he's done, to the National Press Theatre, where a slate of cabinet ministers ready to take more questions from journalists there about the government's response to the latest response and measures taken to the COVID-19 outbreak, which will include limiting the number of airports that will be accepting foreign travelers to Montreal, Toronto, Calgary, and Vancouver. New screening measures at the border we've talked a little bit about already for passengers arriving at ports of entry in Canada, and then lots of questions, I think, about why these measures now. More questions about about distancing and about self-isolation for Canadians, and of course questions about the economic impact. And what the government may be prepared to do with that, and more measures coming. So while we wait for that, we're going to take you back to Ontario for a second, and the Premier of Ontario, Doug Ford, and cabinet ministers there and health officials as well met with reporters today. And what the Ontario government wanted to announce was one thing principally, and that was that it's going to be ensuring that it's going to introduce legislation to make sure every Ontario worker who has to miss work and perhaps miss a paycheck because of the COVID-19 outbreak will be made whole. The Ontario government will take measures to make sure that everyone is paid. And after that announcement, Doug Ford and his cabinet ministers took some questions from reporters. So we'll stand by for the Prime Minister, let you hear a little bit about that. As soon as Justin Trudeau comes from the microphone, we'll be back.
Premier Ford, other areas, we've been told by the federal health minister that we have a very narrow window to control this or attempt to control this. Other areas are shutting down restaurants, anything that is non-essential. Is that on the table? Are you considering it? Do you see that coming soon as a measure?
Well, I can say everything's on the table, but we take our advice off the Chief Medical Officer and take his direction moving forward, similar to what we did when we closed the schools. He gave us advice that the schools should be closed within an hour. We closed the schools. But this is changing rapidly, Cynthia, and we will take it day by day.
Are measures being put in place right now to actually be able to implement that if it comes down to it?
Well, again, we will make decisive action once the Chief Medical Officer tells us that we need to shut it down. We'll shut it down. Thank you.
Hi, Premier.
Hi.
No, oh, sorry.
Yeah.
Sorry, I spoke with U of T epidemiologist Dr. David Fisman this morning, who's very critical of the public health leadership in the province right now. He says the window of time in which Ontario can prevent ICUs from being overwhelmed is rapidly closing or may have already closed because Ontario has been too slow to implement strong enough social distancing measures. What is your response to that?
Well, I'll pass that over to the Minister of Health to answer.
Thank you. Well, I want the people of Ontario to know that we've been watching the situation very carefully. I won't even say day by day. It's really hour by hour. And I would ask Dr. Williams to come forward with a few comments because we are speaking about this constantly. We know that we are dealing with a narrow window to take action. And of course, we are prepared to do so immediately if we need to. Dr. Williams, would you come forward and make a few comments on that issue, please?
Thank you. And certainly the aspects around modeling is a useful tool to use in scenario design. And we continue to use that to drive our decisions about planning so we can be proactive in those areas and to use that for forecasting. As always, you have to go back to the data, what is actually happening. And we try to certainly deal that daily with our testing. With our testing mandate and how well we have our equipment and supplies, as well as advice to the public in all those regards.
All right, Peter Van Dusen, we see the Prime Minister at the microphone. Let's listen in.
Over the past few days, we've seen COVID-19 spread around the world at an even faster pace. Canada is no exception. From the very beginning of the outbreak, our government took necessary measures to protect your health and safety. We've based our response on science and evidence, on input from our world-class health professionals and authorities. We continue to base our response on keeping Canadians as protected and as supported as possible. We assured you that as the situation evolved, our response would evolve too. As the virus continues its spread, we've decided to take increasingly aggressive steps to keep you and your family safe. D'abord, nous fermerons nos frontières aux gens qui ne sont pas citoyens ou résidents permanents du Canada. Cette mesure prévoit certaines exceptions désignées pour notamment les membres de l'équipage, les diplomates, ceux dont la famille immédiate est canadienne et pour l'instant, les citoyens américains. First, we will be denying entry to Canada to people who are not Canadian citizens or permanent residents. This measure will carve out some designated exceptions, including for air crews, diplomats, immediate family members of Canadian citizens, and, at this time, U.S. citizens. Deuxièmement, les compagnies aériennes recevront le mandat formel d'interdire à tous les voyageurs présentant des symptômes de la COVID-19 de monter dans un avion. Les compagnies aériennes effectueront une évaluation de base de la santé de chaque passager selon les recommandations de l'Agence de la santé publique du Canada. Ça veut dire que toute personne présentant des symptômes ne pourra pas entrer au Canada. Je sais que c'est une nouvelle qui va provoquer des inquiétudes pour beaucoup de Canadiens qui sont à l'étranger. Je veux vous assurer que notre gouvernement va continuer de vous appuyer. Pour aider les Canadiens asymptomatiques à rentrer au pays, notre gouvernement mettra sur pied un programme d'aide pour les Canadiens à l'étranger. Les voyageurs canadiens pourront obtenir du financement pour les aider à rentrer au Canada ou couvrir les coûts essentiels en attendant de revenir au pays. Second, air operators will be formally mandated to prevent all travelers who present symptoms of COVID-19 to board a plane. Air operators will be required to complete a basic health assessment of every air traveller based on guidance from the Public Health Agency of Canada. This means that anyone who has symptoms will not be able to come to Canada. I know this news will spark concern among Canadians travelling abroad. I want to assure you that our government will not leave you unsupported. To help asymptomatic Canadians return home, our government will set up a support program for Canadians who need to get on a plane. Canadian travellers will be able to get financial assistance to help them with the costs of returning home or temporarily covering their basic needs while they wait to come back to Canada. Troisièmement, à partir du mercredi 18 mars, seulement 4 aéroports canadiens accepteront les vols internationaux. L'aéroport Pearson de Toronto, l'aéroport Montréal-Trudeau, l'aéroport international de Vancouver et l'aéroport international de Calgary. Pour l'instant, les vols domestiques ainsi que les vols en provenance des États-Unis, du Mexique, des Caraïbes et de Saint-Pierre-et-Miquelon ne seront pas touchés par cette mesure. Les restrictions de voyage annoncées aujourd'hui ne s'appliqueront pas au commerce et aux échanges. Nous continuons de faire en sorte que le Canada puisse continuer à recevoir les marchandises importantes. Third, starting Wednesday, March 18th, only 4 Canadian airports will be accepting international flights: Toronto Pearson, Montreal Trudeau, Vancouver International Airport, and Calgary International Airport. At this time, domestic flights, as well as flights coming from the U.S., Mexico, the Caribbean, and Saint-Pierre-et-Miquelon, will not be affected. The travel restrictions announced today will not apply to commerce or trade. We will continue to ensure the supply of important goods to Canada. I know that these measures are far-reaching. They are exceptional circumstances calling for exceptional measures. Earlier today, I had a call with our G7 partners to inform them of these important changes. From the very beginning, Canada's response has been based on the latest available science and advice from our world-class health professionals. Today's announcement is no different. These measures will help save lives. Depuis le début, c'était important pour moi que les Canadiens aient accès aux recommandations des experts et des professionnels de la santé. C'est leur savoir et leur expertise qui guident les démarches non seulement entreprises par les gouvernements, mais par les individus. La Dr Tam, les professionnels de la santé publique et nos ministres font un travail extraordinaire pour protéger la santé des Canadiens et les garder au courant des derniers développements sur une base régulière. Comme la Dr Tam l'a dit hier, les autorités de la santé publique ont administré 25 000 tests à date et leur travail continue. Pour assurer que le plus grand nombre de Canadiens possible puissent avoir accès aux dernières informations, Santé Canada fera sa mise au point quotidienne au même endroit et à midi à partir de demain. Aujourd'hui, leur point de presse suivra immédiatement la mienne. Dr. Tam, public health officials and our ministers have been doing a tremendous job of keeping people safe and providing regular updates. As Dr. Tam said yesterday, public health authorities have conducted 25,000 tests to date, and this work continues. To ensure that more Canadians can have access to the latest information on COVID-19, Health Canada will be holding its daily update at the same place at noon, starting tomorrow. Today, their press conference will take place after my remarks. Les mesures annoncées aujourd'hui s'ajoutent à tout ce que notre gouvernement a fait jusqu'à présent. Vendredi dernier, le ministre Morneau a annoncé des nouvelles mesures pour appuyer financièrement les travailleurs et les employeurs à travers le pays. We will make $10 billion available in additional support for Canadian businesses. This is a tool that has worked before in difficult circumstances, and we're confident that it is going to work again. The economic impact of this pandemic is shifting hourly, and we recognize the stress and anxiety that it is causing. As I've said, we are prepared to see Canadians through this time. We will have additional measures to announce as early as tomorrow to support Canadians, particularly our most vulnerable. Right now, provinces and territories are facing different realities and risks, which means taking steps that make sense for people in each area. At the same time, we also need to keep building an aligned, Canada-wide approach. On Friday, I held a telephone meeting with the Premiers and Deputy Prime Minister Freeland, and information has been flowing continuously since. We've been in constant communication with the provinces and territories so that there are no barriers between our jurisdictions during this critical time. During the meeting, I spoke to premiers about the $1 billion COVID-19 response fund our government has put in place, which includes support for provinces and territories and their healthcare systems so hospitals can prepare. We can still slow the spread of this virus, but as Dr. Tam said, that window is closing. So far, we've seen many provinces take aggressive steps to protect their communities. I want to thank them for their work. It's time to take every precaution to keep people safe. The COVID-19 Response Fund also includes support for Indigenous communities. On Friday, I spoke with First Nations, Inuit, and Métis Nation leaders to discuss the work we're doing together on preparedness and mitigation efforts. Minister Miller also provided an update on our regular coordination with Indigenous partners, as well as the provinces and territories. Minister Van Daal has also been connecting with the territories and is working on exceptional measures to protect the North. We're making sure that everyone, no matter where they live, is prepared. Les mesures annoncées aujourd'hui s'ajoutent aux recommandations émises par les professionnels de la santé publique. Je tiens à rappeler à tous les Canadiens qu'ils devraient éviter les voyages non essentiels à l'extérieur du pays jusqu'à nouvel ordre. Nous recommandons également à tous ceux et celles qui sont présentement à l'étranger de rentrer au pays alors qu'il est toujours possible de le faire. Je vais être clair. Si vous êtes à l'étranger, il est temps de rentrer chez vous. Si vous venez de rentrer, vous devez vous isoler pendant 14 jours. Et finalement, tous les Canadiens devraient rester chez eux. En restant chez vous, vous pouvez non seulement protéger votre santé et celle de vos proches, mais faire en sorte que nos professionnels de la santé et nos systèmes de santé puissent aider davantage ceux qui en ont besoin. I want to remind all Canadians that they should avoid non-essential travel outside of our country until further notice. Canadian travellers should return to Canada via commercial means while it is still possible to do so. Let me be clear. If you're abroad, it's time for you to come home. If you've just arrived, you must self-isolate for 14 days. And finally, all Canadians, as much as possible, should stay home. By staying home, you can not only protect your health and that of those around you, but ensure that our healthcare professionals and our healthcare systems can focus on those who need their help. This is an adjustment for all of us. We know that staying home is an important step to protect the community and each other. We all have to do it. But I want to remind all Canadians that social distancing doesn't mean we have to stop talking to each other. Pick up the phone, write an email, FaceTime. The strength of our country is our capacity to come together and care for each other, especially in times of need. So call your friends, check in with your family, think of your community. Buy only what you need at the store. But if you're heading out to grab groceries, ask your neighbor if you can get them anything. And if you know someone who is working on the front lines, send them a thank you. See how they're holding up. In Canada, we're lucky to have outstanding healthcare professionals. I want to thank them once again for their tireless efforts to keep us all safe. At the same time, our government is doing everything it needs to do to keep you safe, to keep your family safe, and to keep our economy strong. No matter what our next steps look like, you can rest assured that we will take them together, with premiers and mayors, with doctors and families and neighbours, because that is what Canadians do in difficult times. We pull together and we look after each other. Merci beaucoup tout le monde.
Bonjour, Louis Blouin de Radio-Canada. Monsieur Trudeau, la réponse de votre gouvernement, elle est critiquée. Il y a des gens qui jugent que ce que vous annoncez aujourd'hui, ça vient beaucoup trop tard, que les contrôles aussi qui ont été réalisés dans les aéroports ont été laxistes. Ma question, est-ce que vous assumez la moindre responsabilité pour ce que plusieurs considèrent comme des ratés de votre gouvernement?
Nous comprenons que la situation évolue extrêmement rapidement. On a pris des mesures importantes au cours des derniers jours et on continue à prendre des mesures importantes aujourd'hui. Je comprends la préoccupation des gens, mais je peux vous rassurer que les mesures sont en place pour nous garder en sécurité.
Donc, juste pour...
Okay. I will highlight that the situation, as we all know, has been evolving extremely rapidly. We've taken measures over the past number of days to keep Canadians safe, and we're taking more measures, significant measures today. I can understand people's frustration, and that's why we're ensuring that there is more that will be done every step of the way to keep Canadians safe.
Juste pour être clair, donc vous n'admettez aucune erreur?
Écoutez, il y a toujours des choses qu'on doit faire et on va continuer d'en faire plus à tous les jours.
Sur la question des États-Unis, pourquoi ne pas inclure les États-Unis? Puis qu'est-ce qui entre dans l'équation?
Nous coordonnons extrêmement attentivement avec les États-Unis. J'ai parlé plusieurs fois au cours des derniers jours avec le président Trump. Nous allons reconnaître l'intégration de nos deux pays à tellement d'égards que ça exige un niveau de coordination particulier pour les prochaines étapes et on est en train de le faire.
Glenn McGregor, CTV News. Prime Minister, you've been telling us for several weeks now that a travel ban was not required, that it wasn't helpful. What changed your mind overnight, and do you regret not acting sooner to take this step that's taken by other jurisdictions, other countries?
This situation, as everyone knows, has been evolving extremely rapidly, and the recommendations of public health and public safety have been evolving as well. At every step, we've taken the best advice of our public health officials, and now is the time to take this particular step. It is a significant step. It is a step that we take in exceptional circumstances, but it is the right step to be taking today.
Another brutal day on the stock markets this morning. TSX is down 7% just this morning, actually almost 8%. What is your message to Canadians who are seeing their retirement savings being wiped away, and especially those who are thinking of retiring in the near future?
Our focus right now is on ensuring that Canadians who are staying home from work have enough money to be able to buy groceries and pay their rent. These are measures that we will be moving forward with in the coming days to ensure that people can keep themselves and their loved ones safe and healthy. We will, of course, be moving towards supporting businesses, as we already have, with significant access to credit of $10 billion and other measures to ensure that in the short term we are able to continue to support each other. In the medium term and then into the long term, we will need to invest significant amounts to restore people's confidence in the economy, to restore the kind of growth that is going to ensure a better future for all Canadians, and we will do those things as we need.
De TVA. Pour continuer sur la même veine, je comprends qu'il y a des annonces qui s'en viennent pour ce qui est de l'aide aux familles spécifiquement, mais pouvez-vous dire aux Canadiens, aux familles qui ont besoin d'aide, à quel moment elles pourront toucher l'argent?
On va rendre de l'argent accessible pour nos familles les plus vulnérables dans les jours à venir. On comprend qu'il y a énormément de gens qui sont extrêmement inquiets pour la capacité de nourrir leur famille, de payer leur loyer, des préoccupations extrêmement concrètes, particulièrement pour des gens qui n'ont pas l'assurance emploi, qui sont dans des emplois vulnérables ou à temps partiel. C'est pour ça qu'on a avoir des annonces à faire dans les jours à venir qui vont démontrer que ces gens vont avoir de l'argent nécessaire pour passer à travers des semaines à venir.
Est-ce que les gens pourront avoir l'argent?
On va annoncer dans les prochains jours ces mesures-là.
Public health officials say many of the new cases can be traced to the U.S. Why are U.S. citizens exempt from entry restrictions to Canada?
We have been collaborating very closely with the United States, coordinating various measures that we've taken together. The level of integration of our two countries is quite particular, which is why we need to do some more work in order to ensure that we're doing what we need to do in the right way. But our first preoccupation is and always will be the continued safety of Canadians, and we will take the measures necessary to keep Canadians safe.
But then why are U.S. citizens being allowed into Canada? What does this mean for the U.S. border? Is it going to be closed at all?
At this point, we are closing our borders to all non-Canadian or non-permanent residents of Canada. We are recognizing that for the moment that measure does not apply to U.S. citizens, but we will have more work to do in the coming days to ensure that we're doing everything we need to do to keep Canadians safe and to ensure the flow of goods and necessary equipment to Canadians.
Donc, vous gardez la possibilité de fermer la frontière canado-américaine. Quel sera l'élément déclencheur pour fermer cette frontière avec les États-Unis?
Comme j'ai dit, à chaque étape, nous ne fermons pas la porte à aucune mesure qui pourrait garder les Canadiens en sécurité. Nous allons faire les évaluations étape par étape sur la meilleure façon de nous garder en sécurité. On a pris une grosse étape aujourd'hui. Il va y avoir d'autres choses à annoncer dans les jours à venir sur différents niveaux. On va à chaque fois faire l'évaluation de comment mieux protéger les Canadiens, comment garder notre pays, notre économie, nos citoyens en sécurité et assurer l'intégrité et le bon fonctionnement de notre système de santé.
À l'heure actuelle, l'épicentre de la pandémie est en Europe. Certains craignent que ce soit bientôt les Américains, les États-Unis. Est-ce que c'est pour ça que vous gardez la porte ouverte à fermer la frontière avec les États-Unis?
Comme j'ai dit, on ne ferme pas la porte à aucune mesure. Tout est sur la table pour protéger les Canadiens, mais on va y aller étape par étape, comme on l'a fait depuis le début, pour prendre les mesures nécessaires au moment où ils seront nécessaires.
You've said that your decisions thus far have been dictated by science. What is the science behind leaving the U.S. border open but denying entry to other travelers?
We recognize that the level of integration of our two economies and the coordination that we've had over the past while puts the U.S. in a separate category from the rest of the world. But we will continue to coordinate with the U.S. We will continue to examine next steps and measures that must be taken. Today we are announcing that we are closing our borders to all foreign nationals from everywhere around the world. We will have more announcements to make in the coming days as this situation evolves.
You said also that citizens people returning to Canada must self-isolate for 14 days. Are you preparing any measures to ensure that they do that, or is this still voluntary?
If we put in measures for mandatory self-isolation, as many people have looked for, there would need to be enforcement measures around that, both by public health and by public safety. We know that at this point, the expectation that people self-isolate is something that we've asked of Canadians around the country, that we are expecting people to do. We know that Canadians want to keep themselves and their families safe, and we are confident that people will do what is necessary to keep themselves, their loved ones, and their neighborhoods safe.
Christopher Nardi, National Post. On Friday, Health Minister Patty Hajdu said, and I quote, "Canadians think we can stop this at the border, but what we see is a global pandemic, which means that border measures are highly ineffective and, in some cases, can create harm. We see that in countries that had the worst expressions had the tightest borders." What changed?
We have seen over time various countries take very stiff border measures that proved ineffective. In Canada, we based our decisions on public health recommendations that ensured that Canada's approach worked for many, many weeks in keeping a very slow spread of the virus in Canada through contact tracing and other measures. We've now come to the point where the best advice from public health officials is that additional border measures on top of the social distancing measures that we are encouraging domestically is the right combination to move forward now.
We've seen throughout the weekend complaints that airports weren't able to keep up. They weren't advising travelers. What makes you think that suddenly closing the border and redirecting flights to 4 places, the bureaucracy will be able to adapt and actually enforce these measures?
We've already seen shifts at the airports where every single traveler gets asked if they have symptoms, gets asked to acknowledge that they've been asked to self-isolate. We will be putting forward more support in those 4 airports as well. I want to highlight that local jurisdictions are also stepping up to assist in those 4 airports. We know that there is much more that we can do, and that's what we are doing.
Guillaume Saint-Pierre, Journal de Montréal. Il y a un haut fonctionnaire de l'OMS qui a dit dans les dernières heures, je vais le citer, le problème qu'on a dans la société actuellement, c'est que tout le monde a peur de faire une erreur et des conséquences que cela pourrait avoir. Mais la plus grande erreur est de ne pas agir, d'être paralysé par la peur d'échouer. Est-ce que c'est une critique qui s'applique à votre gouvernement, à votre pays?
Au contraire, à chaque étape, on a pris les mesures nécessaires recommandées par les meilleurs experts pour garder les Canadiens en sécurité. Et c'est une des raisons pour laquelle, depuis le début de cette crise du virus, on a vu des mesures qui ont fonctionné au Canada. On a une trajectoire qui a été plus basse qu'ailleurs dans les pays occidentaux. On a pris des mesures additionnelles aujourd'hui parce que c'était le temps qu'on les prenne. On a eu une rencontre du cabinet hier soir où on a discuté longuement de la science et des recommandations. Et on est confiant qu'on est en train de faire ce qui est nécessaire pour garder les Canadiens en sécurité aujourd'hui. Mais comme on sait, on est dans une situation qui évolue constamment et on va vous mettre à jour au fur et à mesure qu'on prend des mesures additionnelles.
Vous dites que vous vous fiez aux meilleurs experts, aux experts en santé publique, mais tous ne s'entendent pas non plus nécessairement sur les mesures à prendre. Est-ce qu'il n'y a pas un moment où des décisions politiques doivent être prises pour assurer la population?
Ultimement, les décisions sont prises pas par les scientifiques, mais par des personnes élues pour servir les Canadiens. Et ça, il y a toujours un élément de cette discussion qui doit prendre en compte les inquiétudes et les comportements des citoyens. Ça fait partie de notre responsabilité en tant que gouvernement et c'est exactement ce qu'on a fait. Merci beaucoup tout le monde. Bonne journée.
All right, Peter Van Dusen watching along with you, and the Prime Minister announcing measures that go further than most people had been reporting or most speculation had pegged, and that chief among them, the border, closing to everyone except Canadians or family members of Canadians who are non-citizens, and Americans for the time being, the Prime Minister said. So the border open to Canadians and Americans largely only. And some of the other exceptions include diplomats and flight crews. In a couple of seconds, we'll be moving to the National Press Theatre, where a number of different cabinet ministers will be at that table to answer more details about what's been announced today from Justin Trudeau. And clearly more questions will be asked about the border. And you heard lots of reporters asking questions about, the suggestion from a lot of critics that this measure should have been done weeks ago, that it's coming too late, and wondering why the Americans are something less significant to the measures at the border. Daily updates from the Public Health Agency will be done from now on every day at noon to give Canadians the latest on where they're at, although today that update is now following the Prime Minister's comments with Cabinet Ministers here in the National Press Theatre today at 2 o'clock here in the nation's capital. Martin, what are your thinking? Martin Seepak, Martin Singer's with me watching along. What are your thoughts as we watch these measures announced today?
Well, the first thing that comes to mind is that the doctors, the health authorities, the epidemiologists are going to say there is a big question here, and that is 24.4 million Americans cross the border to Canada, either in day trips, repeated trips, tourists, or business. And a vast majority of them, many of them were tourists as well. So that's 24.4 million people crossing the border. Even if we assume that a lot of that is drying up, that's still, even on a slow month, almost 1 million to 2 million Americans crossing the border. We know the situation in the United States, so obviously it is a health decision that the Canadian government is going to have to come to. As you mentioned, the Prime Minister was questioned about that. There's a question of trade, but there's also a question of a very large number of people crossing the border. The other interesting announcement, which will be a great help, knowing someone who's tried to leave, who's left Spain, who's now in Slovakia, and is unable to get flights back for the next 2 weeks to Canada, those people trying to return to Canada, he's announced aid for people who to either defray some of their costs in getting back to Canada, or if they are, like my friend who's in Slovakia, under a shutdown, unable to get back to Canada for the next 2 weeks. So that is a very welcome announcement in terms of just small but very important aid for Canadians. If the Prime Minister says it's time to come home, that might help things a bit.
And just keeping, because the story changes so quickly, keeping abreast of sort of developing news as well. Here's what we're hearing out of Alberta. Sources telling the Canadian press, Dr. Dina Hinshaw, who is the public health officer, and she's been the face of the response in Alberta, has now herself been put in self-isolation. So she's been on the front lines of dealing with this outbreak in the province of Alberta. Perhaps you've seen her in those daily briefings. She is, according to Canadian press, in self-isolation. So there's I think we're getting an Alberta briefing coming up later today, so we'll have a chance to find out the latest on that and trying to, you know, this is not unexpected. We've seen these stories of certainly healthcare workers on the front lines, in some cases in critical condition, having been fighting this. Some of them are in the hospital themselves being treated, and that's always a great concern when you have an outbreak such as this and a virus such as this, is the vulnerability and the threat to those people who look to help all of us on the front lines of the healthcare system in this country. And it looks like the medical officer of health in Alberta is herself, perhaps at this point, one of those casualties, as she has been put herself in isolation. So we'll see where that takes us in that story this afternoon. As we stand by to go to the National Press Theatre for Cabinet Ministers responding and elaborating on those announcements from the Prime Minister today. How did you think of the way the Prime Minister handled the questions from reporters that basically are questions fueled by the comments we've heard from health professionals in many cases in this country, in some cases opposition parties saying far more needed to be done about the border and why it's taken so long to do it? Well, stand by. So we're going to get to some of those questions again. I think we'll again be asked of the ministers who are gathered here today. You see them, the Public Safety Minister from left to right, Bill Blair, Marc Garneau, the Transportation Minister, Deputy Prime Minister Chrystia Freeland, Health Minister Patty Hajdu, the Families and Economic Development Minister Jean-Yves Duclos, and we were supposed to see the Public Health Officer there as well, Theresa Tam, and I don't see her there unless she's in. Let's listen in and see what we hear from this news conference.
We'll take 5 questions from the floor, and then we'll go to the teleconference after that.
Okay.
Minister.
Merci beaucoup. Bonsoir, est le vice-président du comité du cabinet sur la COVID-19. Les docteurs Tam et docteur Nou vont parler avec vous après cette presse-conférence. Nous avons décidé que, à cause du conseil de maintenir la distance sociale, que c'était mieux d'avoir seulement 6 personnes ici à la fois. Nous vivons dans une période critique et nos efforts visent à contenir l'épidémie de COVID-19 et à réduire la charge sur notre système de santé et nos professionnels excellents. Notre priorité est la santé et la sécurité des Canadiens. We are taking a whole-of-government approach and indeed a whole-of-Canada approach to limiting the spread of COVID-19 and to keeping Canadians safe. The measures which the Prime Minister announced just now are essential to that effort, and we will continue to adapt our approach to the ever-changing environment in which we all now exist. As Dr. Tam said yesterday, Canada's window to flatten the curve is closing. I urge Canadians to listen to the valuable advice from our public health professionals and public health officials. These are and must be our entire country's trusted sources of advice and information. And what the experts are telling us is that this situation will get worse before it gets better. This is not a time to quibble about federal and provincial responsibilities or about who will pay the bill. Our clear priority is and must be the health and safety of Canadians. And I have to say, I am so proud of how Canadians, from business to labour, from Indigenous leaders to premiers and mayors, and of course our outstanding healthcare professionals, are all rising to the challenge together. Starting today, we will be formalizing formal federal government updates as daily briefings for Canadians. We will also provide a daily briefing for all parliamentarians. So now we're going to hear from the Minister of Health, Patty Hajdu, then the Minister of Transport, Marc Garneau, then the Minister of Public Safety and Emergency Preparedness, Bill Blair, et mon cher collègue, le président du Conseil du Trésor et le vice-président du comité du cabinet sur la COVID-19, Jean-Yves Duclos. Merci. We'll be ready to take your questions then.
Well, thanks everybody for joining us, and good afternoon. As Canadians know, the cases of COVID-19 are rising in Canada, and all levels of government have been working together to prepare and support Canadians through this unprecedented health crisis. First, I want to offer my deepest thank you to those on the front line, the public health officials, the border service agents, the healthcare workers, and the many others who are working so hard on behalf of all of us. And I also want to thank all of the other workers who are often unseen and unsung, the cooks, the cleaners, the drivers, and others who are keeping all of the things that we need running. As you've heard Dr. Tam say, now is the time to pull out all of the stops to flatten the curve or slow the rate of infection. Nous devons essayer très fort ensemble. This will be very hard, and it will require much personal sacrifice, and it will require all of us helping in many different ways. Ensemble, nous pouvons aider nos familles, collègues et communautés. The measures that we take together now will protect people in our communities who are most at risk and ensure that our healthcare system can meet any surge in demand. All of us can take actions to reduce the spread of COVID-19. Stay at home, wash your hands well and often, and practice social distancing. I know that many people are worried about running out of food and other essential supplies. Please know that we are not running out of food or other supplies. The Retail Council of Canada is working very closely with our government to ensure that our supply chain remains strong. Please don't buy more than you need in a 2-week period. Remember your neighbors, those people that buy just in time, and buy only what you need. Be kind to one another. Even though this is going to be very hard, Canada is strong, Canadians are strong, and we've been through times that are hard before. The things that we do now that require sacrifice and generosity will get us through this time together.
Okay, et maintenant le ministre Garneau.
Thank you. And so let me get into some specifics about travel. Today, as Minister of Transport, I am enacting measures under the Aeronautics Act in order to reduce the spread of COVID-19, especially through international travel. As the Prime Minister stated, effective March 18th at noon, Canada will deny boarding to all foreign nationals on flights to Canada other than transborder flights, in other words, flights from the U.S. and to any foreign national who has resided outside of Canada or the United States in the last 14 days. The measure will not apply to Canadian citizens and permanent residents, immediate family members of citizens or permanent residents, to air crews, to travelers in transit to another country, and to diplomats. Je veux répéter en français. Dès midi, le 18 mars, le Canada va refuser l'embarquement à tous les citoyens étrangers prenant des vols vers le Canada à partir d'un autre pays que les États-Unis, ainsi qu'à tous les ressortissants étrangers ayant résidé ailleurs qu'au Canada ou aux États-Unis dans les 14 derniers jours. Cette mesure ne s'applique pas aux citoyens canadiens et aux résidents permanents, à la famille immédiate des citoyens canadiens et des résidents permanents, aux équipages et personnels de cabine, aux voyageurs en transit vers un autre pays et aux diplomates. Canada will also introduce screening measures for passengers before they board flights destined for Canada. Air operators must do basic health assessment of all air travelers before boarding, following guidance from the Public Health Agency of Canada. Any passenger, regardless of citizenship, with possible COVID-19 symptoms will not be allowed to board flights to Canada. Les compagnies aériennes devront aussi faire une évaluation des passagers avant qu'ils embarquent dans un avion à destination du Canada et toute personne ayant des symptômes de COVID-19, peu importe leur nationalité, ne sera pas autorisée à embarquer. If a passenger begins to show symptoms during a flight, there are procedures for dealing with this, including notifying air traffic control with details of the situation so that that particular passenger can be met on landing. In addition, effective March 18th at 12:01 a.m., in other words, a minute past midnight on Tuesday, all flights from Europe, Asia, Africa, and South America will be diverted to the Montreal, Toronto, Calgary, and Vancouver airports. Flights from the U.S., the Caribbean, and Mexico can continue to land at their scheduled Canadian destinations. By keeping resources focused in certain locations, we will ensure travelers are being managed as efficiently as possible. We're working closely with the airline industry and with airports to minimize disruptions and inconveniences as much as possible. Passengers who believe their travel plans may be affected should contact their airline for information about specific flights. Domestic flights between Canadian destinations are not affected by this change. I want to thank airlines and airports for their cooperation as we manage this ongoing situation, as well as to all flight crew personnel for their cooperation. These measures will carve out exemptions for certain essential workers who need to travel frequently into the United States. They will be exempted from the 14-day